Hi, so this project is about hospital management using blockchain. So think about it. What if your medical records work like a Google Drive but on blockchain? Like you'll upload your health data and just by sharing a Google Doc, you will give access to the doctor with a click and you can rework it in any time. But here's a twist. It's 100% secure, tamper proof, and no one can access it unless you allow it. Like no hospital systems or no middleman can access your data. That's exactly what our healthcare system on Ethereum does. So here's how it works. First, we'll have the role-based registration where the patients and doctors will register the details and it will be stored securely on-chain, thus ensuring identity integrity. And second is full data ownership and access control. The patient will have the full permission to give who and all the access they want to grant or revoke for the medical data, and this is completely transparent and blockchain based control. And the next thing is we have secure insurance backed transactions where the patient will pay 2 ethers for a particular medical record, and after the doctor claims the insurance, he will do a diagnosis and he will give the result for the diagnosis. And the next one is we have tamper proof medical records. So as these records are saved on hashes, so the data will be immutable, decentralized, and no one can access it, and the both parties will be verifiable for the medical records. So coming to the project, what are tools you are using in this are? First one is Hardhat, which you know is used for testing and compiling a smart contract. The second one you are using is MetaMask. This is for your crypto wallet and deploying tool. The next one is React.js. This is the modern DApp framework frontend we are using. The remix idea at last you are using for writing and compiling the smart contract. Now coming to the project, so this is what our application looks like. So first you have to connect to a particular wallet. As you see, I have a MetaMask wallet and I am connecting to the account 8 0x3c. I will register for a patient. I can see I have no profile here, but I can register as a patient. I will give the name patient 1. And my age is 26, and I will give a particular C hash, IPFS hash. So IPFS will be saving in the IPFS and we will be using it directly. I'll show it once. So now I am uploading a particular file. It's a sample file MR medical report. I will upload it. After uploading it, we will upload in the Pinata. So after uploading it, a particular CID will be given, and the CID we have to there's a hashed CID which we will give here. So after this, we will register as a particular patient with my health record. For each and every transaction, a particular gas will be required. So data successfully saved. At the same time, I also log in through a doctor account and I will create a register for doctor also. I will take account number 6 for as a doctor. Going to account number 6, I am going for a doctor. You can see there is no profile for doctor now. So I am giving the name doctor 1 and his age may be 40. He also has to give an IPFS record of his profession, and designation is 1. So a transaction will be again carried out, and this is also saved successfully. See, the information is doctor 1 and his age is 40. Now he will get the records from the patient, which the patient will give access to. As you can see, this is the patient account and the patient profile. You can see that the patient's name and the number of doctors he has authorized, and there's no medical records yet, like the diagnosis report, and this is the IPFS link. So now coming to access, here's where we will give the access to the doctor. You can see we are giving to access doctor 1. Give access. A particular transaction will happen. And you are confirming it. Now you can see the authorized doctor will change to 1. At the same time, you will also go to the doctor side and we will see what has happened. Now we see doctor side. See, there's accessible patients. We are getting the access patients. We can use details, name, age, and what's this IPFS record. So here you click and he will see the report. And after this, the patient has given two ethers for the has given the 2 ethers as credits for the insurance policy. And yeah, now you can see the ethers count have been increased to 200 ethers. Now the credit we are giving to patient 1, and he had to give the diagnosis report, which is 245. Diagnosis report are some numbers or some text and numbers included, like it's a section number of particular disease or particular fever, etc. And again he had to give his diagnosis report, like what is the diagnosis about the patient he had found out. And yeah, he can claim the insurance. Now this 200 ethers will be given to the doctor. You'll see the ether count will load to 0. Yeah, so now again I will log in through the patient, and we will see what happened to this data. So coming to the patient portal, now the diagnosis authorized doctors will change to 0, and this will take some time to load. Yeah, and so again no authorized doctors yet, so it will take some time for the account to give. And in the meanwhile, you can also check what are transactions happened. This is a transaction which happened here. ICD 245 is our diagnosis code, and it's given from doctor 0F39 to 03C4. And yeah, now if you view the profile, you can see the medical records. Yeah, it will take some time to load. It's just general. And you can also revoke the doctor if you want, after giving the doctor some access. Like now I'm giving the access, you can see. Now it will again change from 0 ethers to 200 ethers, which will again take some time because loading. See, the account will be increased to 1. Then again, if you give revoke the access, you can revoke the access. Like some loading has happened. See, now you can revoke the doctor if you want. You'll also get the doctor's details. You can view the doctor's details also. And yeah, you can revoke the doctor if you want. Again 200 ethers will be given back to you itself. Yeah, line takes some time generally. See, again shows 0 ethers. So yeah, this is what the whole project is about.